Yeah, just wanted to thank you all for being here. We can go ahead and get started in just a few minutes. So yeah, if you haven't yet, feel free to introduce yourself in the chat box. Awesome. Yeah, well, happy Friday, everyone. Thanks for being here. If you do not know me yet, my name is Sarah Chalice. I'm one of the outreach coordinators with Connect-OC Partners for Wellness. Yeah, and also the co-host of the coalition meeting with Erin. But I will go ahead and pass it off to the rest of my team to introduce themselves before we get into discussion. So I'll pass it to Crystal.
Thanks, Sarah. Good morning, everyone. Thank you for joining us again today. Crystal Blaisher, Program Director with Partners for Wellness and Connect-OC. I'll throw it to Joy because I can see you on my screen.
Hi, everybody. I'm Joy. I'm the outreach coordinator on the team, and I specialize in network coordinating. So yeah, happy to be here. I'll pass it to Vivi.
Morning, everyone. I'm Vivi. I'm also one of the other outreach coordinators, but I mostly focus on social media and marketing. So if you see a newsletter from me, that's me. I'll pass it to Erin.
Morning, everyone. My name is Erin O'Flaherty. I'm the Community Engagement Manager for Partners for Wellness, and I get to manage our cultural arts and mental health outreach program.
Thanks, team. Yeah, so before we get started, just wanted to discuss that Connect-OC. If you didn't know yet, Connect-OC is a program of Partners for Wellness in partnership with the Orange County Healthcare Agency. And our focus is basically to educate and promote existing mental health resources in Orange County with the mission just to make them more accessible and widely known to youth and young adults. And those who love and support them as well. So yeah, and with that, I can go ahead and pass it on to our panel. We have Dr. Ramesh and Alyssa. Yeah, maybe I'll start with Alyssa just to have you introduce yourself really quick.
Sure. Hey, everyone. My name is Alyssa. I'm an LCSW. I'm located in Los Angeles and been at Charlie Health for about 2 years. And prior to that, had about 12, 13 years of in-person experience and higher levels of care, residential, PHP programs. And now I'm with Charlie Health virtually, which is an IOP program.
And Dr. Ramesh, if you can introduce yourself really quick.
Hi, everyone. I'm Ramesh. I'm a PsyD, and I'm the Assistant Clinical Director at Norooz Clinic Foundation. We're a nonprofit mental health care organization, and I'm very pleased to be here and nice to meet you all.
Thanks so much. Yeah, that's awesome. So yeah, if you could each kind of tell us a little bit more about you mentioned briefly the types of service or the organizations that you're from. If you could maybe go a little bit deeper into what Charlie Health and what Norooz Clinic is, and then just the different types of services that you guys can provide to individuals.
Of course. Happy to start. So yeah, like I said, I'm with Charlie Health. We're a completely virtual IOP company, so intensive outpatient. Really, that means we're working with pretty high acuity clients. Many are stepping down from higher levels of care, such as residential, hospitalizations, PHP programs, or they're stepping up from outpatient. Maybe once a week therapy isn't enough for them based on presenting symptoms. And so in our IOP, clients are receiving about 9 hours of group therapy, 1 hour of individual therapy, and it's not mandatory, but highly encouraged to do the 1 hour of family therapy as well. We also have psychiatry available. So it's pretty intensive. Like they are getting 10 to 11 hours of treatment per week. Like I said, everything's virtual. It's a pretty short-term program, so around 90 days is our average length of stay. And so really the focus is stabilization. You know, if clients are stepping down from hospitals after an attempt or have active SI, HI, self-harm behaviors, how can we help stabilize you in the home before moving down to once a week outpatient therapy? So that's really our goal, is stabilization, safety, and then ideally moving them down to a lower level of care, such as outpatient.
Thanks for that, Alyssa.
All right. At Norooz Clinic Foundation, we're a nonprofit mental health agency, and we cater to the population age range from 3 years old to 103 years old. Although we provide different services such as individual therapy, couples therapy, family therapy, group therapy, also free peer support groups for our clients, we do not cater to high level of care, such as clients in active psychosis or severe schizophrenia. But other than that, anxiety, depression, all sorts of personality disorders, we cover it all.
Awesome, thank you both. So yeah, this question can be for both of you. Feel free to jump in if you have some cool insight. But personally, or just in your work, how have your experiences with clients been, either like in the virtual or the in-person setting?
I think both formats, they have their own specific rewards and their unique rewards. The telehealth and virtual sessions have given us the ability to provide healthcare services for clients who have mobility difficulties, or they don't have access to transportation, or they have severe anxiety of attending in person. And then again, in-person sessions cater to clients who do benefit from nonverbal communication, and they need that, especially the younger age, children, teenagers, young adults, they do benefit more from nonverbal communication. So both are wonderful, and we do cater to the client's specific needs. So whatever suits them best, we choose that format for them.
Yeah, I agree. Really, both in-person, virtual have barriers, pros and cons, can be really beneficial. And like I said, I came from about 12 years working in person, and now I've shifted to fully virtual. And so I've seen and been around both. I think part of it is the client's willingness to change and heal, and that can be done in a virtual or an in-person setting. You know, they can show up and they can choose to turn their camera on and really engage, or they can show up and choose to have their camera off and be driving to soccer practice. So there's absolutely barriers and challenges, but I think first it starts with just clients' willingness to heal, to change. I think rapport and trust can be built in easily in both settings. For example, like in person, it might be easier to pick up on nonverbal cues. Maybe you notice in person someone squeezing their fists as they're talking, and you can like sense that anxiety. But there's other ways to pick up on those cues virtually. Might be able to see what's in their background, or again, if their camera's on or off, or if they're twirling their hair. There's definitely other ways and cues to pick up on clients. What else? I think really in terms of modalities, like and populations, again, kind of like Dr. Ramesh said, there's benefits to both. For example, OCD, I've done a lot of exposure work in person where I can take a client to Home Depot and work with them in that setting and walk through Home Depot and like expose them to loud noises or whatever the exposure is we're working on. But in virtual, I can ask them to bring their computer over to the kitchen and turn their stove on and off with me if that's an exposure we're working on. So I think part of it is also just creativity and finding unique ways to engage the client in both settings.
Yeah, that's really insightful. I honestly, I was like the creativity aspect that you like mentioned. I was like, oh, that is true. Like you could really kind of take your therapist with you like everywhere. And like even if like for example, like the OCD example of having a specific fear or something, you can like be there with them as they're like being exposed to the trigger, and that's like super interesting to hear. But yeah, thank you so much for both of your inputs. Yeah, so I just wanted to maybe go over what the different sessions could look like, if there's any differences. So yeah, if you have any insight, what does like a typical telehealth session look like, versus what does kind of like an in-person session look like? Or if they're the same. Yeah.
Well, telehealth session and in-person session, the key component of both sessions is therapeutic alliance and rapport. So when you create that safe environment for your client, be it virtual, be it in person, that is the most important thing. So again, the key is active listening. The key is empathy. If you provide that for your client, the feeling that I'm not judged and I am in a very safe space. So this is the most important aspect of therapy, and building that working alliance and that trust in your client. So, and this is what you provide in both settings for your clients, virtual and in person. It doesn't make any difference. I personally feel that, especially with younger population, you can build that trust a bit faster when you have in-person sessions. It takes maybe a little while to build it in virtual sessions, but nonetheless, it's doable. And yeah, but it's safe, just safe space and rapport, active listening, empathy, and validation.
Yeah, totally agree with all that. That's where it starts. I think, again, there's maybe a little more like creativity that comes into the virtual work. For example, art therapy. How can we get creative? And there's online sand tray exercises we can do, or I've done a screen share of coloring a mandala. So again, there's some creativity that comes into the virtual aspect of it, but if you can build that trust and rapport and have that strong working relationship with your client, I think it can be very successful in both settings. For Charlie Health specifically, like I said, our goal is really stabilization for those higher acuity clients. So we're maybe not getting into like a deep dive of trauma. For example, we're doing more skill building, regulation skills, maybe DBT skills, ideally to like stabilize them and prepare them to move to outpatient and do some deeper diving into their trauma, for example. So I would say the only modality we don't really use is EMDR, because many of our clients are just not stable enough to do that, but many of them, the goal is to get there for sure. So it's really meeting the client where they're at and assessing their needs, again, both in person or virtual. It can benefit them.
Yeah, that's awesome. Yeah, thanks for sharing that. So specifically, yeah, Connect-OC kind of tailors toward the transitional age youth population. So maybe like 14 to like 26-ish. So do you notice specifically maybe in that population, maybe any differences or changes in just engagement or even participation between different modalities of therapy? Maybe even with like pre-COVID and like after COVID, like is there any differences or changes that you guys have noticed in that maybe specific population?
In that specific population, I have noticed that in-person works faster. But having said that, yes, just faster. But that doesn't mean that virtual sessions don't work, especially with youth that suffer from ADHD. And when attention is a problem, so when we do those sessions virtual, they tend to get distracted more. And in person, you can bring the attention back. And as Alyssa mentioned, body language, you can read the body language better. This population, I have noticed that they benefit a lot from non-verbal communication. So in person, in my opinion, works better with this population. But having said that, we have had clients who have, we've done virtual work with them, and it's been very successful. It takes just a little bit longer.
Yeah, I absolutely agree. I think to add on to that, I failed to mention at the beginning, Charlie Health takes ages 11 to 50 right now. So we're definitely able to engage clients virtually who are 11, 12, 14, 17. Like I previously said, part of it is just motivation for change. So when they log into the Zoom, do they have their camera on? Are they in a private, confidential, safe place for them and ready to start that healing process? Or do they log on and say, my parents are forcing me to be here? And they could say that in person too. They could refuse to get into the car and drive to the in-person therapist. So again, it starts with that therapeutic rapport and relationship you have with them. But I think again, barriers with that population, it is slower to build that rapport. Can we, if they don't come on video, can we try for 5 minutes today? Or one cool feature of Zoom is you can hide your self view. So maybe clients with self-esteem issues or eating disorder, they can just see you and hide their self view. And I've seen that that works a lot. Accessibility to internet, Wi-Fi access. We do work with clients who are struggling with homelessness. We can send them an iPad if needed. Many clients, I think a lot of it is about finding that safe place for them, and their bedroom is often a safe place. Or if there's too many people in their home, they can go to their car as long as they're not driving. But finding like a safe private space is important. So with virtual, obviously there's increased accessibility, but there are barriers in terms of Wi-Fi access, refusal to join on video, and just that like slowness to build the rapport, but it can absolutely happen. Yeah, I think that's it on my end for that one.
Yeah, thank you for that. Yeah, just wanted to keep kind of touching on barriers. You kind of brought up really good points of maybe a few barriers that virtual therapy kind of possesses. And but yeah, Dr. Ramesh, I wanted to hear maybe your experiences with barriers like with in-person in-person therapy. Yeah, and maybe how you're trying to address it, or maybe just some insight on that.
So challenges in person versus virtual.
Yeah.
Yeah, so I have come to realize that for certain populations, in person can be more beneficial. For instance, Alyssa mentioned play therapy with children. Yes, we can be very practical in using play therapy as we're doing virtual sessions, but honestly, in-person contact, working with children and using play therapy, art therapy would be more beneficial, works faster. Also, I've come to realize that with clients with severe focus difficulties, again, virtual sessions bring up a challenge working with them, and also severe anxiety, trauma-focused interventions. Also, I have noticed that working in person, that in-person contact works best for clients with trauma. So these are the challenges. But again, having said that, we have come a long way in virtual therapy and working with our clients. So both formats, again, work perfectly. And it all goes down to the client that you're dealing with and their specific preferences.
Yeah. Just to add on that, I think one specific population that would benefit from in person is clients on the autism spectrum. We definitely can and have worked with clients on the spectrum, it can absolutely work, but I sometimes think we get to a point where like we need to do some in-home work, in-person work, work on the structure routine around the home, build socialization skills. Um, as Dr. Ramesh mentioned, ADHD. So I think neurodivergence has its uniqueness to it in terms of virtual in person.
Yeah, that's all. Yeah, really great insight on kind of maybe some of the barriers and maybe some of the benefits even of each type that we mentioned. But yeah, I just wanted to maybe like touch on like someone is looking for therapy but have like a specific like maybe mental health challenge or maybe even like a neurodivergent um thing, and what like specific maybe mental health challenges would you recommend for like virtual versus like in-person therapy? Maybe what ones benefit more than the others, or yeah, if that question made sense.
I believe strongly that it goes down to the client's preference. So it's best to keep an open mind and open heart and try one format and then be open to try another if it doesn't work for you. So try both formats and see what works best for you. It's up to the client which format they want to choose.
I agree. Just as an example, I've in my time in residential or PHP, we had a client on the autism spectrum who parents would drive them there, and it honestly probably took him 2 hours to get out of the car and agree to walk into the room and meet some other kiddos and join the group. And then we tried a virtual session, and he was very willing to log on from his bedroom. He like put on a Minecraft background. He had his Minecraft emojis, hanging out with the therapist. And it was just what he needed in that moment. And the goal was to work towards coming in person because those were some socialization goals he needed. But we met the client where he was at, and we started with what he needed in that moment. So I totally agree again with Dr. Ramesh. Like it's really what the client wants and needs in that moment, their motivation for change. And both will work, but I think you have to do that assessment of like, let's work together, let's try this, and then we can move to the other one. If possible, we can refer you out if possible, but let's at least give it a try.
Yeah, that's awesome. Yeah, just having an open mind and being willing to, yeah, be flexible maybe with each modality of therapy, and yeah, that's really great. So yeah, I just wanted to touch on maybe the therapeutic alliance that you had mentioned both earlier, and just kind of, yeah, what's your insight, maybe your experiences of maybe more a little bit more specific of what the therapeutic alliance looks like in virtual versus in-person therapy. Like you said, I think it was Dr. Ramesh said it takes a little longer for rapport to be built over virtual, but I just wanted to see if you guys had any further insights or experiences with that.
Well, rapport building and achieving that therapeutic alliance, it's the core of your therapeutic work with the patient. So creating an environment that is safe, that is non-judgmental for them, so they can share their feelings and emotions with you, feeling that you have empathy, that active listening, that they feel someone is listening to me. And then when you rephrase their sentences, you talk to them, they feel that I'm heard and my therapist does understand me. I always tell my clients that we're working together. We are a team, and I'm standing side by side with you. We're going to have a toolbox. Every time we meet, we're going to have a new tool and we're going to put it in this toolbox. And then every time you need one of them, you just open your toolbox and you use that. So that therapeutic alliance, again, is very important. It's the core of your therapy. If it doesn't happen, the rapport, if it doesn't happen within the first 2 sessions, honestly, the clients need to find a different therapist. Because if you do not feel safe with your therapist, if you do not trust your therapist, progress is not going to happen. In virtual sessions, sometimes therapeutic alliance happens slower, but it always happens. So both formats, again, are very beneficial and work for this day and age in 21st century. And again, for some clients, is very practical to use telehealth services. For some, they prefer that in-person connection, so they choose to come to the session. And yes, that's what I have to say about therapeutic alliance, core of therapy.
Absolutely agree. And I think I mentioned this earlier, but like picking up on those nonverbal cues can be done virtually, such as, hey, I see in your background a teddy bear on your bed. Tell me more about that. Or with the younger kiddos, hey, do a show and tell around your bedroom and let me see what interests you have, hobbies. Or I'm noticing in your background XYZ. Tell me more about your pink hair. When did you dye it? So again, like you can absolutely pick up on those cues and build that rapport virtually. I think I always tell my therapist, like, give it 30 days. So maybe it is a bit slower in the virtual setting, but it absolutely can happen. And that is the core of therapy. I think sometimes virtually clients do feel safer in their bedroom, in their private space. I think there could be a barrier to that because then they're maybe processing some intense trauma or doing some hard work and in their bed where they're also trying to sleep. So that's like something you want to think about and separate. But it could also be a really safe place for someone on the autism spectrum who struggles to leave their room, or someone who's isolating and is ready for change and wants to be in therapy but struggles to leave their house.
Yeah, that's all really great. But yeah, I just wanted to touch, maybe Alyssa, you said you mentioned just like being in a home and like being in a room. How do, like, when you're working with clients, how do you like ensure privacy within the home, and especially if a home is like really busy with lots of kids like running around or parents coming in and out, like how do you manage like a privacy in that?
Yeah, good question. I mean, the very first thing is they sign on and, hey, it's good to see you. Just want to make sure you're in a private, confidential space. Sometimes you can hear noises in the background. Hey, I hear a lot of people. I just want to make sure the door's closed or that you feel safe. Headphones is always an option, but I still say someone can hear your side of the conversation, even though they can't hear me. So that's not the end all be all answer. Sometimes we'll brainstorm, like, can you go to a car, or can your parents go on a walk outside for the 50 minutes we're meeting so that you can be in the house alone with me? There's absolutely barriers to it. You might have a house with 7 kids running around. I've done a session for a few weeks and found out mom had her ear to the door the entire time and client didn't know. I asked every time, client, are you in a private space? And he said, yes, I'm in my room, I'm good. Really open, engaged in the process, and then found out mom had her ear to the door listening in. So ultimately, you don't know, but that led to a very stern conversation with mom about HIPAA and confidentiality and privacy. Sometimes I'll relate things to the medical profession, just like you walk into your OBGYN office, you want to be private. Same with therapy. And so I think sometimes relating it to a medical profession is helpful for clients. Yeah, I hope that answers the question.
No, that's great. I really like that, especially like adding it and like making it have maybe more, making it more practical of like, oh yeah, you're at the doctor's office or the OBGYN and you want to be private. It's like, oh yeah, like people just don't seem to like connect it sometimes with that like privacy with your mental like space is also just as sacred as like physical health, which is so Interesting. But yeah, thanks for sharing. Dr. Mesh, did you have anything to add, or are you good?
I 100% agree with Alyssa. Yes, everything that she said. Make sure, your control is limited with virtual. Make sure that you tell them that door is closed, no one is around, camera is on, so you can also monitor and see if anyone is around. But other than that, yes, sometimes little accidents like what Alyssa mentioned do happen, and you have no control over that. But yeah, Alyssa, you said it.
You both. Yeah, I wanted to actually touch on what maybe what group therapy looks like. Like virtually, does group therapy like work well? Like is that, or is it maybe a little tougher to manage virtually versus in person? Because like in person is so much different than just dynamic wise and like nonverbal communication with like between maybe other individuals, other participants. Could you maybe talk a little bit about what maybe group therapy or couples therapy even would look like in both settings?
We provide a number of support groups at Norooz, and they work phenomenal, actually, because especially with our schizophrenic population, they do have this anxiety of joining in person, many of them, so that virtual setting provides a safe and secure environment for them to participate. And also, in regular group therapy, friction and de-escalation is a lot easier because you can immediately move the rowdy participant to the breakout room, and it's not going to physically affect the other participants. So virtual sessions and telehealth group sessions have actually proved to be very practical. As far as couples therapy, there was a time that I would have both couples on one camera, and I realized that, okay, this is not working. So I asked them to go to separate rooms and use their separate laptops or a phone and join the session. So a group therapy and couples therapy, I don't see any difference between that and in-person sessions. If anything, actually, maybe the participants benefit more from virtual sessions.
Yeah, I can speak to Charlie Health and our group program, but in general, I agree group works very well in both settings. I believe we run up to 700 groups a day at Charlie Health, which is pretty wild. And I think a unique part of our program is all the group cohorts that we have, and virtual allows us to do that. So when you're in person, you're running a group in PHP, like my previous experience, you're kind of forced to run a group with the 5 people in the program for that day. And it could be a 14-year-old on the autism spectrum and a 17-year-old who wants to learn DBT skills and a 12-year-old who needs more play therapy, like doing group on the basketball court. And so somehow you got to meet all of those needs. Virtually at Charlie Health, we've created all these cohorts to meet each client's needs. And so, for example, we have an adolescent neurodivergent cohort and a young adult neurodivergent cohort. We have an LGBTQ cohort. We have a military family cohort. We have a postpartum cohort. We have DBT skills. Again, all of these are adolescent, young adult. So really, once they do their intake assessment, they're placed into a cohort based on presenting symptoms and diagnosis. They can definitely move around if they prefer. They've tried DBT and they want to go to our trauma focused cohort, they can absolutely change throughout treatment. But I think that's what makes Charlie Health specifically and virtual group so unique, is like we can place people from all over the country into these group cohorts, and they can meet people in different states. I think we try to aim for 8 people in a group at the most with one group facilitator. So I think that's a huge benefit of our virtual group programming, is they can really like build those relationships with people who have similar presenting symptoms, similar challenges, similar age. We also have a family support programming curriculum. So families, siblings can participate and join our weekly family support groups, totally optional. They can even attend after their child has discharged from Charlie Health. For example, working with your client on the autism, or working with your child on the autism spectrum, or working with a challenging adolescent, or just a way for families to connect and build relationships in general. And then we also have an alumni program, and that's a really cool virtual program where once clients discharge from Charlie Health, we have lots of groups where they can connect and maintain some of those relationships that they've built in group. But yeah, I really think group can be done both virtually and in person. In terms of crisis, like Dr. Ramesh said, like we have what's called a care coach or a crisis manager, can easily pull someone out into a side breakout room and do some processing, regulation, reminder of skills, and then bring them back into the room. So just like you can do that in person, hey, let's go take a break, play some basketball, we'll come back. We can do that virtually as well.
Thank you both. Yeah, that's really interesting just to see how, like, it seems like it could, both modes of therapy could be very different, but they could also be very similar of like destabilization, like you said, Alyssa, of like you can take someone out of a room just like you can in person, which is like really interesting. It's really eye-opening, I think, for me specifically too, of like these modes of therapy are both very beneficial. But yeah, I wanted to talk about maybe like what it's some advice. So say a client or a potential client was wanting to seek therapy but not knowing which one fit them best. Do you have any advice on helping somebody navigate if they should do it virtual or in-person therapy?
I suggest to the client to try both. Maybe come to the office, get familiar with the office, and see how you feel in that setting. Maybe give the telehealth session one try. Actually, get yourself familiar with the setup of your session and get over maybe the anxiety of, oh, is the session going to work? Am I going to be able to log in? So become familiar and comfortable with the setting in both settings, and then choose for yourself. Again, it all goes back to what the client prefers. Let them try both formats and see which format works best for them.
Yeah, I agree. You don't know until you try it. So absolutely try both. I think looking at reason for admission, what's the reason you're seeking therapy? What are you wanting to work through? Do you have previous therapy experience? What was that like for you? Previous diagnoses. Even depending how they answer that question, I would still say let's give it a try either way. Of course, with Charlie Health, it is fully virtual. But we can say let's try it for 30 days and refer you to in person if it's not working.
Yeah. Do you notice like either of you, I know let's say you're fully virtual, but if you have maybe some insight of like, do you guys do hybrid, maybe hybrid therapy, or does hybrid therapy work? Yeah, what can you kind of expand more about what that looks like?
Absolutely. So I do have many clients. Actually, at Norooz, we have many clients who do hybrid. Sometimes they prefer to come in person. Sometimes they're in Northern California, for instance, and they cannot join in person, so we do it virtual. Sometimes they have a cold or a flu, but they do not want to miss their session, so we do it virtual. Yes, hybrid is actually a privilege that has been given to us since COVID, and it's very practical, and it really works very well.
I agree. We've been able to treat clients all over California. I think that's a unique aspect of virtual is, let's say you're looking for a very specific EMDR therapist and you can't find one in a 10-mile radius of your home. You can look all over the state of California for a licensed clinician with that specialty you're looking for. But yeah, if you're in person and you're sick that morning and you still want to make it to therapy, log in virtually. So it's a privilege to be able to do both.
Yeah, I feel like that's like, I feel like you get the best of both worlds almost in that kind of setting. And I personally have never, like, I was like doing research about hybrid. I was like, hybrid counseling. I'm like, I've never heard of that before, but I was very curious to see what that looked like. But I mean, it just sounds ideal. It sounds great. Awesome. Yeah, so what do you think, kind of looking at future trends, maybe first question, are you noticing more clients wanting to be more virtual versus in person? Is there like a shift happening? Like what does the future of the therapeutic environment look like? Have you seen anything changing?
Yes, virtual therapy is going to advance, and more and more people would like to take advantage of it. So I do see that change because it's very convenient. And it has made therapy accessible to many people. People with severe anxiety who do not want to leave their home. As Alyssa mentioned, maybe the client feels safe on their bed, sitting on their bed. They do not want to leave the bed. And people who live in rural areas, in remote areas, people who do not have access to transportation. So I see that shift, I see that change, and it is happening. But also keep in mind that in-person connection will always remain at the heart of therapy. So no matter what happens to therapy, in person and the importance of therapists will remain the same.
Yeah, that was beautifully said. I don't think I can follow that. I think virtual's gonna always be there and continue. And as technology expands, I've even heard talks of like doing virtual reality. You can be in the room with them, put on the VR glasses, work through an exposure or a fear or challenge in that moment. So I'm sure that virtual is gonna continue to expand. But yeah, at the end of the day, like you can build a human relationship and connection, whether it be virtual or in person, but in person is how therapy started and that's at the core. But it can benefit both can benefit clients, absolutely.
I love that, Dr. Ramesh, of just like the heart of it is the human connection, and that's so beautiful. And it's so true. Definitely resonates. Yeah, so maybe just maybe a one last question of yeah, if somebody wanted to start counseling and therapy, how can they contact you all? How can they get started? Yeah, what does that look like to on board with you, both of you?
With Norooz Clinic Foundation, they can go on our website, they can email us, or they can call us. Our admin team will match them with the perfect therapist for them based on a presenting problem. So we look forward to that. And yes, they can access us, email, phone call.
Does Norooz Clinic do like, and do they accept insurance or yeah?
Yes. Yes, we are a nonprofit, but we also accept insurance.
And same with Charlie Health, just charliehealth.com, and it takes you right to our intake admissions page. You can either call the phone number or you can actually go through the process yourself online, sign up for an intake assessment, create a client portal, and schedule an intake. Yeah, we make it pretty easy. We try to do an intake within two days, ideally. We don't have a wait list at this time. That's one of our big goals is just you've been discharged from a hospital. How do we get you in? Because when there's a gap in service, that could lead to going back to the hospital. So we're really big on matching you right away, getting that intake in. You can start your groups before you're matched to a therapist so that you can at least start the group process and then start individual treatment or family. So yeah, we want to make it easy and accessible.
Yeah, that's awesome. Yeah, so can you maybe offer what kind of services, like do you do like free group therapy as well? Or is there like different like levels of like if you take insurance with groups or things like that?
We provide numerous free group therapy sessions for clients on top of individual therapy and family therapy and couples therapy.
Nice.
Yeah, and we are connected to many insurance companies around California, but we do have a pretty robust like scholarship program, financial support if needed. Once someone is connected to us, parents, family can join our free family support programming during treatment and after, like I had mentioned. So yeah, we do our best to connect anyone with treatment. If it doesn't work with Charlie Health, we will provide you referrals. We will make sure that you have somewhere to go instead of just saying no.
That's awesome. Yeah, thanks, Alyssa. And it's also great to know that you don't have a waiting list. That's like such a big thing, like that we've been seeing in a lot of college students come to our events and they're like, do you have any like resources, because everybody's on a waiting list and like it's like 6 months out and I need care now. And yeah, awesome. Norooz Clinic doesn't either. That's great. But it's great to know that you don't, and you can kind of serve immediately, which is great to hear and so encouraging. But yeah, I just wanted to maybe open it up. Does anybody have any other questions in the chat for either of them before we move on? No? Cool. Awesome. Well, thank you both for just being here and being willing to share insight on yeah, what this could look like. I feel like it's something that's talked about but not talked about a lot. Just maybe can seem really overwhelming and yeah, just kind of getting a grasp on what that could look like in therapy and healing and stuff like that. So yeah, thank you both so much. But I'm actually gonna we do have some program updates. I'm gonna actually pass it to Erin for yeah, a special announcement.
Hello again, everyone. And I do want to say to the panelists, that was an amazing discussion. Thank you for sharing all of that wisdom. And we do have an exciting event coming up on June 13th at the Newport Beach Civic Center. We're celebrating the different various groups we've worked with this year through the Cultural Arts and Mental Health program. And we've worked with a lot of foster care organizations and TV shelters and within teens who are runaway and homeless, and also just within schools like high schools and colleges. And so this is our chance to gather and really celebrate them and to have an art exhibition of the art pieces they've created. We're going to have live music. We're going to have a taco truck. It's at no cost, and especially would encourage program managers on the call today, if you'd like to learn more about our program. This is a great way to come in and see who we've worked with and just learn more. So we'll put the flyer, or maybe Crystal will for me, in the chat, and then we'll send it out with the event recap as well. So anyway, yeah, we'll get that to you guys, and just wanted to share that. It's June 13th. Registration's free. You can also email me directly, and that's at the top of the chat. It's eoflaherty@p4w.org, and I'll reserve your spot. So thanks again, everyone.
Thanks, Erin. Yeah, we're really excited about just kind of getting to celebrate all the busy workshops that Erin's been putting together in her team, and yeah, just would love to highlight that. Yeah, so we won't be having a coalition meeting next month, but instead we do encourage you all to attend, yeah, our event that's coming up. But does anybody else have any program updates or yeah, any events coming up that they want to share? Go ahead, Lisa.
Perfect. Thanks, Sarah. Good morning, everyone. My name is Lisa Nino, and I am the Senior Operations and Clinical Services Manager with Thrive Together OC. So I have just one training that I want to share about. It is a virtual training on Zoom. It's going to be comorbidity and clinical high risk for psychosis in youth. It's going to be 1.5 CEs. That's coming up on May 21st. So I'll go ahead and I'll drop the registration link in the chat. The second thing is more of a just shout out to our team. We actually had a great turnout at our first ever Mental Health Matters Together We Thrive Community Resource Fair this past Tuesday. So we are in the process of like kind of just posting like kind of gratitude for some of the in-kind donations we received, as well as just photos from the fair. So see that coming soon. But for Dr. Jason Schiffman's training, I will go ahead and drop that link in the chat. Thanks, Sarah.
Yeah, thanks, Lisa. I'm actually gonna put a little QR code. I hope that works. But if you could all take a moment to take our survey, it's really short. It's like 4 questions, just about what went on today. And yeah, just helps to give us insight on future meetings and things like that. So yeah, if you could scan that QR code and take the survey, that'd be awesome. Does anybody else have any events coming up that they want to share? No?
We do have an update at Charlie Health. So we actually just announced that we're now doing co-occurring and secondary for eating disorders. So we can now accept that population as well and help get those clients into care. And also too, I don't know if you guys are aware, but we actually offer some free support groups as well to the public. So there's one specifically for parents and caregivers that's really great. That happens every Monday at 5 p.m. But I'll throw that in here as well, because I know sometimes when parents do kind of go through this with their children, they're looking for someone to lean on. So it could be really great for them to all get together and discuss.
Awesome. Yeah, that'd be great,
Yeah.
Sarah. Yeah. Anyone else? Awesome. Yeah, so thank you so much again to Alyssa and Dr. Ramesh for your insight and your expertise on this topic. Yeah, and just shedding some light on it. And yeah, thank you everyone. Have a great rest of your day and your weekend. Enjoy the warm weather. I'm very excited for the warm weather myself. But yeah. Have a great rest of your weekend, and we will see you either at our in-person event on June 13th or at our next coalition meeting in July. Thanks, everyone.
Thank you so much, everyone. Bye.